Hello everyone. So today there is a different topic that's Chiari Malformations. So in this video I'll be discussing only the Chiari type 1 malformation, and rest of them will be dealt in the subsequent videos. So let's start with Chiari malformations. So we have different kinds of Chiari malformations, which are actually a related group of hindbrain malformations, may or may not be associated with hydrocephalus. So it's the hindbrain malformation. Okay. In the classification of Chiari malformation, we have Chiari 1, Chiari 2, Chiari 3 malformations, and the various modifications of these are the Chiari 0 malformation, Chiari 1.5 malformation, Chiari 4 and Chiari 5. In this video, I'll be discussing only the Chiari type 1 malformation. Okay. So before starting with the actual pathology, let's review few of the anatomy. That's the anatomy of the posterior fossa. So Chiari malformation is the hindbrain malformation. Why? Because of the smaller posterior fossa. Okay. So let's see the first let's see the basic anatomy here. Like this is the cerebellar tonsil. Okay, this is the cerebellar tonsil, and this is the basion, the end point of the clivus, and the pointed end of the occiput. So this is the basion, this is the opistheon. The line joining the basion and opistheon is the basion opistheon line or the Macquerie's line. And see, this cerebellar tonsil is actually above this basion opistheon line. Okay, and also the see this is actually this is the nucleus gracilis, and this point the end floor of the end point, or we can say where the central canal joins with the end point of the fourth ventricle, is the obex. Okay, so we can see this obex and this nucleus gracilis lies above this basion opistheon line. So we have to remember this basic anatomy, that the cerebellar tonsil and the obex and the nucleus gracilis lies above the level of the basion opistheon line. And also see, the tonsil is actually rounded in its inferior aspect. Okay. See this thing on the sagittal, that's the mid sagittal T2 images as well. The cerebellar tonsil is rounded and it is above this basion opistheon line. Note, this obex and the nucleus gracilis is also above this basion opistheon line. And in this image that is slightly off mid sagittal is also depicting the same thing, the rounded end of the cerebellar tonsil and the folia are horizontally oriented. So this is the basic anatomy of the cerebellar tonsil. So when we call cerebellar tonsillar ectopia, okay, so there are few terminologies: the tonsillar ectopia, then low-lying tonsil, Chiari malformation 1, acquired tonsillar ectopia, and tonsillar herniation. These all are different terms. We have to know the meaning of these terms. Also, the cerebellar tonsil is actually, it ascends as the patient ages. So let's see the terminologies first. So the very first term is the tonsillar ectopia. Okay, cerebellar ectopia is a umbrella term, okay, which includes everything, whether it is acquired or congenital or the cerebellar tonsil, where the level is. Whenever the cerebellar tonsil is below the bastion-opisthion line, it comes under the tonsillar ectopia. So it's an umbrella term which involves all these other terminologies. Okay, cerebellar tonsillar ectopia means just the tonsil is below the Macrie's line. Okay, below the Macrie's line. Below Macrie's line. This is tonsillar ectopia. Next is the low-lying tonsil. Low-lying tonsil means the tonsils are below Macrie's line, but the measurement is less than 5 mm. So we have to measure the distance of cerebellar tonsil from the Macrie's line. Like this is the tonsil and this is the bastion-opisthion line. So how much is this distance? In low-lying tonsils, these are less than 5 mm. Okay. In Chiari type 1 malformations, this ectopia is more than equal to 5 mm. This is Chiari type 1 malformation. When the cerebellar tonsils are equal to or more than 5 mm below the Macrie's line. What is acquired tonsillar ectopia? When the tonsillar herniation is due to acquired pathology like increased intracranial hypertension, increased intracranial pressure, or the intracranial hypotension. And what is tonsillar herniation? It is the terminology used for acute phenomena, for the acute displacement seen in setting of massively raised intracranial pressure like intracranial hemorrhage or the extradural hemorrhage. So for the acute settings, we have the terminology of tonsillar herniation. All these four terms, if we combine together, it comes under an umbrella term, that is the tonsillar ectopia. Just the tonsils are below the level of the Macrie's line, that's tonsillar ectopia. That may be low-lying tonsil, that may be Chiari malformation, that may be acquired, that may be congenital, that may be in an acute staging, that is tonsillar herniation. So these are the few basic terminologies. Okay, so here we have used the cutoff of 5 mm as the general description, but remember, I have already told this tonsil actually ascends as the patient ages. So we have few age-wise distribution of this tonsillar ectopia. Like for 0 to 10 years, if the tonsillar descent is more than equal to 6 mm, we called it tonsillar ectopia. If it is more than 5 mm for the age group of 10 to 30 year, then for 30 to 80 year, it's more than 4 mm, and for more than 80-year-old person, it is more than equal to 3 mm. So we have learned the basic anatomy, that tonsils are round-ended, the obex, the nucleus gracilis, and tonsils are above the bastion-opisthion line. We have learned the terminologies, the tonsillar ectopia, the low-lying tonsils, Chiari 1 malformation, acquired ectopia, and tonsillar herniation. And we also have dealt the criteria, age-wise criteria of tonsillar ectopia. So with this, now let's start the Chiari type 1 malformation. So Chiari type 1 malformation is actually why this develops? Because of the bony anatomy, that's altered bony plus the altered CSF hemodynamics. Okay, these two are the causative factor for the Chiari type 1 malformation, the abnormal, the altered bony anatomy, and the abnormal CSF hydrodynamics. Okay, what happens in Chiari type 1 malformation? The posterior fossa is small in cases of Chiari malformation. So the posterior fossa, as the posterior fossa is small, the cerebellar tonsil actually descends through the foramen magnum into the upper cervical canal. So what we can see that this is the Macrie's line, the bastion-opisthion line, and the cerebellar tonsil is actually below this Macrie's line. So there is cerebellar tonsillar herniation, tonsillar ectopia. Also what we can see, the end is not rounded anymore, it's pointed, it's peg like. Okay, so the end is pointed or peg like. Also what we can see, there is no that there is crowding at foramen magnum. There is no space behind this tonsil for the CSF to flow. So what is there? There is tonsillar herniation. The tonsil ends is pointed peg like. There is crowding at foramen magnum, and there is obstruction at the level for the CSF to flow below this level. Okay, so in this image also, in the SAG, mid-SAG T2 images, we can see the cerebellar tonsil is actually pointed peg-like. It is below the Macrie's line. Also, see the folias are horizontally angled normally, but here they are somewhat vertically oriented. What we can also see is the crowding at the foramen magnum. This is the spinal cord, and these are the tonsils causing herniation. As they are herniated, they are causing crowding at foramen magnum. We cannot see the CSF space behind at the level of foramen magnum. Also we can see this T2 hyperintense areas in the spinal cord. In these images they are more clear, where we can see the cerebellar tonsillar herniation below the level of the Macrie's line. There is this narrowing and crowding at foramen magnum with development of these T2 hyperintensities in the cervical spinal cord corresponding to the syrinx formation. Okay, so what happens actually, and this cerebellar tonsil that's acts like a piston. So with each heartbeat, this goes down and then ascends. It works like a piston that is traversing up and down with each heartbeat. Okay, so this piston like movement of the tonsil is actually hampering the CSF flow, and that generates actually pressure waves. These altered pressure waves are responsible for the formation of the syrinx or the hydrosyringomyelia. So what we have read so far, let's just revise that. That's Chiari type 1 malformation. That's due to the abnormal bony development and altered CSF hydrodynamics. Chiari type 1 malformation is the most common Chiari malformation, and generally the patients present with Valsalva induce suboccipital headache and neck pain, or that may be asymptomatic. Patients who develop hydrosyringomyelia may present with scoliosis, lower extremity pain, and abnormalities of temperature and vibration sensation. What you get on imaging is caudal tonsillar ectopia more than equal to 5 mm below the foramen magnum or the basion-opestion line. The ends of the tonsils are pointed peg-like. They are no more rounded. With angled folia, they are no more horizontal. The foramen magnum is crowded with effaced posterior CSF spaces. There is diminished or absent CSF flow at posterior foramen magnum, which can be visualized if we do cine MR. And syrinx develops in 10 to 20% of asymptomatic and 40 to 80% of the symptomatic patients. Okay. This tonsillar ectopia has to be differentiated from the normal low-lying tonsils. Okay, the low-lying tonsil that are less than 5 mm below the basion-opestion line. How we have to differentiate? There will be the ends of the tonsil won't be peg-like pointed. These are rounded, and there won't be any disturbed CSF flow. The cine MR will be normal, and there will be no associated syringohydromyelia. Acquired herniation has to be differentiated from this Chiari type well malformation, like whenever there is elevated intracranial pressure or whenever there is intracranial hypotension. We have to differentiate these things from the Chiari type well malformation because the treatment of all these pathologies are different. For example, if the intracranial hypotension is treated with decompression surgery, there will be devastation. The condition of the patient will deteriorate further. As we have read this, the basic terminologies, the various criterias, the features of Chiari type 1 malformation. In my further videos, we will cover rest of second, third, fourth, fifth, 0 and 1.5. Okay, with this I am ending the lecture. Thank you so much for watching and giving your attention. Thank you.